السلام عليكم ورحمة الله وبركاته. اليوم المحاضرة عن Non-Communicable Disease as an introduction to this subject. احنا نعرف Non-Communicable Disease. What that mean? The chronic disease also it is called. That means it is not transmitted from person to person. Tend to be a long duration and are the result of combination of genetic, physiological, environmental, and behavioral factor as a factor and determinant of this chronic disease. The main type of non-communicable disease are cardiovascular disease. You know the example of these diseases like heart attack and stroke, and heart attack like ischemic heart disease, unstable angina, cancers, chronic respiratory disease such as chronic obstructive pulmonary disease and asthma, and also diabetes. Who is at risk of such disease? You should know all age group are vulnerable to the risk factor contributing to the non-communicable disease, whether from unhealthy diet, physical activity, exposure to tobacco smoke, or the harmful use of alcohol. You should know in this subject, non-communicable disease, the steps that the disease, it is gone. The first, it is the risk factor. The disease not yet occur. So in this stage, we can do the primary prevention. If he is smoker, you should stop, quit smoking, to not be move on to the respiratory disease. If he or she obese, she will move on to the diabetes. So you should turn over the fast food, the fatty meal, the bad habit of the diet. Okay? Risk factor. There is two types of risk factor: modifiable behavioral risk factor, which can be changed, like the habit, hobbies. Usually it is the physical activity and the diet, and alcohol and smoking. Metabolic risk factor contribute to 4 keys metabolic change that increase the risk of the non-communicable disease: raised blood pressure, which is also called a pre-hypertensive state, overweight and obesity, hyperglycemia, which are high blood glucose level, but it is not a diabetic patient. It's a pre-diabetic, starting to elevate. Hyperlipidemia, high levels of fat in the blood. Maybe he is or she was a healthy person, but there is hyperlipidemia, there is high level of fat in the blood. Prevention and control of non-communicable disease. To lessen the impact of non-communicable disease on individuals and society, a comprehensive approach is needed, requiring all sectors, including health, finance, transport, education, agriculture, planning, and others. All these issues are included to collaborate to reduce the risk associated with non-communicable disease and promote intervention to prevent and control them. Okay. Non-communicable disease kill 40 million people each year, equivalent to 70% of all deaths globally. It is very high percent. And the non-communicable disease, it is a prevented disease. So we can start it with primary prevention to quit this disease, to cure from this disease. Okay? Each year, 17 million people die from a non-communicable disease and CD before the age of 70. 80% of these premature deaths occur in low and middle income countries because the less investigation, and less accessible to them. Early detection of the non-communicable disease by screening. Cardiovascular disease account for most non-communicable death, or 17 million people annually, followed by cancer, respiratory disease, and diabetes. This is rank. It's very important to save in your mind. These four groups of disease account for 81% of all non-communicable deaths, so it is very, very high percent. Tobacco use, physical inactivity, the harmful use of alcohol, and unhealthy diet all increase the risk of dying from NCD. Detection, screening, and treatment of NCD as well as palliative care are key components of the response to non-communicable disease. This lecture is an introduction to NCD. You should know the risk factor. You should know the rank of the death and the NCD, the percent of NCD death according to all death in the world. And you should know there is a two type of risk factor, modifiable risk factor and unmodifiable risk factor. We insist on the modifiable risk factor because when we change them, we can stop the move to the chronic disease. Smoking, unhealthy diet, hyperlipidemia, hyperglycemia, and starting the elevated of blood pressure. All this, it's pre. The disease is not yet occur, but the pathogenesis started. So when we do the primary prevention, we stop and cure from all these non-communicable disease. إن شاء الله المحاضرة سهلة وقصيرة، هي مجرد بداية ومقدمة للسبجكت الكبير اللي هو الNCD واللي هو كلش مهم. ويا هذه المحاضرة راح أرفق لكم PDF 2 عن الرانك أو البيرسنت أوف الNCD بالعراق. أوكي، 2016 كانت هذه الدراسة، فضروري أنتوا تعرفون إيش قد الوفيات، إيش قد عندنا سكري، إيش قد عندنا هايبرتنسيف بالعراق. تمام، مثل ما نعرف عن the world. Also, we should know what about our country. So, I will attach this with the lecture. Thank you.